My name's Jeff Heslop. I'm an interventional cardiologist and structural heart cardiologist here at St. Alphonsus.
Hi, my name is Joe Walsh. I'm an interventional and structural heart physician at St. Alphonsus Medical Group.
The structural heart program is a collaboration of physicians and nurses and staff who get together to treat some of these limiting conditions of the heart, such as aortic stenosis and mitral regurgitation.
The structural heart is really a field that started about 10 years ago. And essentially what they've done is translate a lot of the therapies that were previously relegated to open heart surgery. And we can now perform the vast majority of those procedures via a minimally invasive approach, either through the leg, through the arm.
The program is meant to really give the patient the best outcome possible and to help them recover quickly.
The most common procedure we perform is called transcatheter aortic valve replacement. That's where we're able to replace a blocked aortic valve through the leg. It takes about 25 minutes. Patients are up walking around within 4 to 6 hours. The vast majority of our patients can go home the same day. The rest of them will go home the very next morning. So as opposed to open heart surgery for a valve replacement where you're typically in the hospital for around 5 days, transcatheter aortic valve replacement really gets the same result as surgery, but the patients are not having the kind of short-term implications of a sternotomy or open heart surgery. So that's the most common one. We also perform mitral valve repairs using the MitraClip. It's another procedure we do through the leg for a leaky mitral valve. So patients with a leaky mitral valve, we can come in, we can go through the leg. In about an hour to 2 hours, we can have their valve from severely leaky down to almost nothing. We perform a procedure called the Watchman procedure, or left atrial appendage occlusion. We now have 2 devices to treat this disease. Atrial fibrillation is a very common abnormal heart problem. The biggest problem with atrial fibrillation is it predisposes patients to stroke. And strokes all occur from a little pocket of the heart that throws blood clots to the brain. So we can actually put a little plug in that pocket to reduce the risk of stroke and get patients off blood thinners. Lastly, we have a very active PFO and ASD program for patients that were born with a hole in their heart that's congenital and are predisposed to stroke. We can go ahead and close that hole to prevent their stroke. So those are kind of the 4 main procedures we do. We do kind of a smattering of other miscellaneous procedures that are structural heart procedures, but that's kind of our bread and butter.
Our team is very collaborative. We counsel together to make sure we're making the best decision possible for each person. It's important to do that because often there's, the issues are complex. We often get a perspective from each other that otherwise we wouldn't have.
We can do a 3-dimensional CT scan and perfectly reconstruct someone's heart and plan the procedure through there. We can use ultrasound during our procedures to visualize the heart and see exactly what we're doing. So it's a rapidly growing field and allows patients to really get the benefits of surgery without all the short-term implications of an open heart procedure. Really anyone with valvular heart disease, anyone with a hole in their heart, anyone who has atrial fibrillation who does not want to be on a blood thinner, those are all patients that are great candidates for these procedures. We are a rapidly growing program. We're enrolling in multiple clinical trials right now that allow our patients to benefit from the innovation that results from having access to clinical trials. So I really feel like we're at the tip of the spear for innovation in our space, and I feel like patients in Boise should recognize that the care they're getting here is equivalent to the care they'd be getting at any university center, whether it's University of Washington or any place in Utah.